volunteers. Okay, Bruce.
Hi, I'm Bruce Symes with Allen County Commission, and I work at the college.
Michelle.
Hi, I'm Michelle Mivas, and I am with Hope Unlimited in Iola, Kansas.
Hi, Paige.
I'm Paige Olson. I'm the Integrated Voter Engagement Advocate for Kansas Appleseed.
And Clara.
Clara Wyckoff. I'm the Nutrition, Food, and Health Agent for the Southwind Extension District. So I work with Amanda, and we cover Allen, Bourbon, Neosho, and Woodson counties.
All right, and Debbie Bearden. Up your mute.
Okay, now can you hear me?
Yes.
Okay. I work with the Allen County Farmers Market and the Allen County Grow, and I'm still with Allen County Farm Bureau for another week, 2 weeks. But anyway.
Awesome. And let's see, Hannah, did I catch you?
Nope, I am Hannah Michelle Jones. I am with Southeast Kansas Mental Health Center as a prevention and promotion specialist.
Okay. Dawn, did I get you?
Not yet. Dawn Burchett, Southeast Kansas Mental Health Center.
Okay. And did I miss anybody? All right, well, thank you all for joining us. And our agency in the spotlight today is Southeast Kansas Mental Health Centers, and we have lots of people joining from there, so we really appreciate that. And I believe Holly is going to be presenting, is that right?
I was definitely on the agenda, but I found somebody even better. And so I am very excited to announce that Dr. Doug Wright, our Chief Operations Officer, is going to do the presentation today.
Very nice.
In other words, she said, tag not it, will you read it? So are you ready for me to kind of give a little snapshot? I think the interest, as I understand it, was really about kind of our merger with Ashley Clinic. What does that mean for the community? Why are we doing that? Really, our chief interest in merging with Ashley Clinic is for integrated care. And why is that important to a mental health center? Well, on average, SPMI adults die 20 years earlier than non-mentally ill adults. And in rural areas, that's as high as 25 years earlier. And why do people with mental health issues die sooner? Well, it's not because of their mental illness. It's because they often don't seek out medical care and don't take care of chronic conditions. Primarily diabetes and heart disease are the #1 killers of people with SPMI. So our goal in this merger is really to help bridge that gap and start to bend that healthcare gap so that people who have serious mental illness are able to live just as long as the rest of us who might not have that. So to that end, this merger has allowed us to take the first steps. Now, this just took place July 1, so we're really new into it. Our initial step is we've blocked time at the mental health center for Ashley Clinic providers to get their patients into mental health services. And on the other side, in the next couple of weeks, we're going to have some times on the Ashley Clinic side so that we can have our mental health providers, case managers, and therapists be able to get that quick access. As a CCBHC, one of the first 6 in Kansas, we also have what we call patient navigators. Patient navigators do a brief physical health assessment and then make those referrals. So they'll now be able to make those referrals more quickly to Ashley Clinic staff, at least in the Chanute, Humboldt area, and maybe elsewhere. And we are taking blood pressures. We're also going to take A1Cs. We just ordered some biometric screening devices. A1C just is sort of like a screener for blood sugar issues, so for diabetes. And that will help us get those people engaged in primary care services much more quickly. And so those are kind of the initial steps that we're taking. We're all kind of very excited about it. We don't know exactly where this will lead us, but we know that very soon we'll have a therapist and patient navigator co-located in the Ashley Clinic. And then down the road, we want to have some of those primary care providers, either their docs or their mid-levels, their nurse practitioners, co-located in some of our offices, just so we help bridge that gap and try to change the life expectancy for people with serious mental illness. So it's something we're very excited about. It's something that's continuing to evolve, but I think it's headed in a really positive direction. So that's kind of the general overview, the general snapshot of it. But I'm curious, what questions do people in the community or with ACMAT have about that merger?
I love the idea. And if we have somebody that we think that would benefit, do we refer you or Ashley or wherever they're comfortable going?
Wherever they're comfortable going. I think that is really the key, is the reason that people with serious mental illness don't often seek out medical treatment is they have that lack of comfort. And so what we're trying to do is take them where they're comfortable. And for some people, they're more comfortable going to their primary care and they're uncomfortable coming for mental health treatment. And other people are comfortable coming to the mental health center, but not their primary care. So we're wanting to work both sides of that. We don't currently have their providers in our offices, but that's coming down the road. But I think start wherever they're comfortable, and we want to be that bridge to help them get access to the opposite side.
Good. Thank you.
What is SPMA?
SPMI,
MI.
seriously persistently mentally ill.
Okay.
We love initials at the mental health center. I don't know if you knew that, but yeah. Great question.
So I think it's an exciting, time. And I think where it affects Allen County is primarily Ashley Clinic does have a provider and a pharmacy there in Humboldt, and continuing that and hopefully growing that. It's a very busy office in Allen County. So hopefully continuing to grow and expand that. Other questions, thoughts, ideas, because we're building it now. So if there are things that you'd like to see in the community that you think, hey, this merger may allow us to do something else, let us know. We would like to hear suggestions too.
I'm trying to think from a bank perspective, because we have elder abuse reporting and things like that. But we wait on a lot of people who we can see that their mental capacity to really handle their own business is declining. Is that something that would fall into the realm of, it's not necessarily mental, but it's like they need assistance. They need some help. Or is that more, what's the other agency there in Schnute?
Area Agency on Aging.
That's it.
Yes, it does fall more specifically under Area Agency on Aging. As a CMHC, we are excluded from making a dementia diagnosis. However, with our merger with Ashley Clinic, medical doctors are able to make that initial diagnosis. So there is the potential we could serve those people in some ways, but in terms of that designation and really a lot of those supports, it comes under Area Agency on Aging. But I would say we're more equipped than ever to help do those initial assessments, because they really require some brain imaging and things like that Ashley Clinic has some access to. Although they don't have the machines there, they have that once every so often truck come in that they can do some of the brain scan MRIs.
Anybody else have questions? I mean, I think that partnership with Ashley Clinic and mental health is going to be a great advantage for a lot of people reaching out.
You could have done that, Holly.
Oh, no, I think you did a great job, Doug. I just need to be here to introduce you. So that was my big moment.
Are there new positions that come with this
Mhm.
merger?
Oh, that's a great question. Yes, so Ashley Clinic has wanted to be able to recruit a number of different positions, from mid-levels to physicians to OBGYN to another pediatrician. And our benefits are better, so we're hoping we can attract some of those. We are also on the mental health side, adding a therapist to put in the Ashley Clinic, patient navigator to put in the Ashley Clinic. And so, yes, it's going to continue to expand and grow. Those are just the initial positions that we'd like to add, but we foresee bringing on mid-levels over time to serve in some of our clinics, at least part-time. So yeah, it's going to continue to grow, but initially therapist, patient navigator, and then filling some of those positions. I would really like to see an OBGYN because there's a huge need for that in Southeast Kansas in general. Allen County Hospital doesn't deliver babies anymore, so a lot of those folks are going down to Chanute or other places, and so that's a need in the area. So that's one position, and then we'll add therapist as well. That's a great question. Other questions?
Do you hope that that will cause by the integration of service? Do you hope that the physician and the therapist will be able to work together with people?
Yes, that is the hope. I think the initial steps will be that warm handoff. One of the things that Dr. Guernsey at Ashley Clinic is very excited about is being able, when he has that depressed person in his office, that he's going, ooh, I think they could be suicidal. I think they need some support. He says, now I can call the mental health center and schedule an appointment, but half the time they don't show. And what I can do now is say, let me have you meet one of my coworkers down the hall and do that warm handoff. I think the other thing that is lacking is, we have psychiatry staff who are prescribing meds, primary care has docs prescribing meds. And that communication piece is not always as good as it should be because they're both busy, because there's releases needed, and some of those barriers go away. So I think on that side, things will happen much, much more quickly. But we know that many people come into their primary care needing mental health services, and there's that gap. And so I think, yes, working more closely in that sense, while the therapist will always probably have that primary role, the ultimate goal for integration, first you co-locate, but you also want to educate each other. Mm-hmm. Hopefully our therapists, our case managers start to learn more about primary care as patient navigators are with starting to take A1Cs and blood pressure. The more knowledge you have about the other side of the house, the better off that you can catch things. Because right now, medical doctors feel like they have a basic training and understanding in mental health. But from a therapist side, I know that they miss a lot.
Yeah.
And just like we have some basic knowledge and understanding of physical health, but I know we miss a lot. When we started Health Home back when Holly started that, however many years ago, we started to learn a lot of our mental health patients had physical health issues and maybe even causing their mental health symptoms, but we're completely unaware of it. So the more you start to work together, the more you build knowledge on both sides to catch things for the other side.
One thing I think would be neat, just hearing you talk about that, is getting some kind of advocate, and might even your patient navigator maybe could do that. Where if the person wanted, maybe their anxiety of going to the doctor is what prevents them. So have an advocate that if they wanted could go to the doctor with them.
Yeah, and that's what our both patient navigators and our case management staff have historically done, but I think there'll be a whole lot more of that.
Good.
One of the things that we've talked about with some of the docs at Ashley Clinic, the surgeons in particular, surgery is a very scary thing for any of us. But I know there's a number of our clients in our Chanute office that have been told they need various surgeries, but because of their stress, their anxiety, they're avoiding those. And that may be one of the reasons that people don't live as long with mental illness. And so we can do some sort of preliminary, hey, let's go together and meet the surgeon. Let's talk through it with the surgeon. Maybe they'll have that surgery that could give them not only a longer life, but a healthier life.
Very good.
Other
I think it's
questions?
Very useful in our instance with children in foster care system. Because a lot of times, because they're not with their biological family, it's not their natural parents that are bringing them to their mental health professional or physician.
Mhm.
So there's not a lot of communication across.
Right. And a lot of times, you know, our case managers, therapists have met with foster parents. They've read what we used to call the Red Book. I don't know if it's still called that. And they have a lot of that history. But I've found that a lot of the providers on the medical side don't have that full awareness. Sometimes they're just being dropped off by somebody transporting that doesn't even know the child.
Right.
So I think sharing that information more fully would be helpful. Dr. McFarland with Ashley Clinic, the pediatrician, she's very excited about the merger. She wants to be able to do some more things within the school system that she hasn't been able to since we're in the school system. And I think those things are important as well. And adding a pediatrician is a goal of ours because I think there's a huge need. And as you well know, kids in foster care system not only have a lot of mental health needs, a lot of times they have physical health needs because they haven't come from the healthiest environments.
Will the clinic and the agency have the same EMR?
That is the goal,
Okay.
because there's a lot of barriers when you're in two different EMRs. I think our first step will be allowing scheduling for both sides, so our front office at the mental health center can schedule for Ashley Clinic and vice versa. But eventually, and that's a big change, eventually we want one EMR.
And just so everybody knows, EMR stands for electronic medical records, so we don't do paper charts, everything is done electronically, so just in case somebody didn't know what that meant, there's your key, I'll be your glossary.
Or acronym person?
Index.
Yeah.
Index, official job.
Yeah.
To be fair, mental health uses a lot of acronyms,
Yes.
but the medical world,
Oh my
a whole lot of
gosh, I
others.
know.
I go in these meetings with them and they're saying these things, I'm going, what is that?
And the amount of letters that you all have after your name is
Yes.
really,
Yeah.
like, we were trying to create name badges and all the letters don't fit, we'd have to
Yeah.
wrap them around, so.
Our team, our marketing team, actually, the prevention and promotion team actually had a meeting with someone at
eliminate?
ACMAT to go over all of those acronyms with us and
Yeah.
explain
What they mean.
What can we drop off?
Yeah.
We're actually part of our training as well.
All the
Like, we
acronyms.
know all of these are all these letters behind the name are very important, so we need something to explain them. to
Work
us.
hard to earn them.
Doug,
so
way to
yes.
go on your PhD, but can we just call you Doug?
Never allow it. My kids would call me doctor.
Right.
Dr. Douglas, whatever.
Great questions. Any other questions?
Thank you so much.
Yeah, thank you guys.
Yes, thank you again. Yeah, that's, I think, like I said, I think this is going to be a great partnership and a benefit to the community. So thank you. All right, we will move on then with our consent agenda. Has everybody had an opportunity to review the July minutes and the treasurer's report and the agenda? Do we need to add anything? Any corrections or updates for the minutes?
Carol and Sandy, I'll move to accept it.
I'll second.
Okay, thank you, Sandy and Bruce. And all in favor of accepting the consent agenda, say aye.
Aye.
Any opposed? Okay. We will move on then. For old business, we have Water Wars, which will be coming up right away on August 12th. And Jessica, I think Marie, we had a couple different options for either using a pontoon or a trailer for the float. Jessica, did you have some response from some of the youth? to
We-
participate?
We are still working on getting a final list for the youth. They keep coming in. So hopefully we'll have that probably by the end of this week. We did secure a truck, Carol. We're gonna be using your truck. And then we can use a pontoon boat for our float. I did reach out to Ashley Clinic to see if they wanted to partner. They had a doctor on vacation. I think he was returning. And Becky Voorhees and I have been working closely together to see if we can maybe combine efforts. I need to have another meeting with Becky today to kind of see where they stand, to kind of see if we need to make it multiple floats because of the numbers that they're getting. So we're gonna have that discussion later today. Other than that, I think we ordered a theme of Under the Sea for the ACMAT group in Southeast Kansas Mental Health Center. So hopefully we'll get some of those decorations in this week and then kind of get a plan of action of probably decorating the night before, which would be Friday, August 11th. And I'm trying to secure a location in Humboldt to do that. And so once I have that, I can email everybody that's going to be participating.
And on that, you're able to get the boat to Humboldt, or do I need to?
I was gonna get with you to see if we can get your truck that night,
Okay,
possibly. If not, I can probably have a friend do it for me. I just need to work those logistics out.
okay, yeah, we'll get together on that then.
Okay.
Sounds good.
I guess an ask is, who in the membership right now would like to participate? Carol. Tegan. Jess. Abigail and Hannah Michelle, are you both gonna be participating?
Yes, we'll be there too.
Yes.
Okay. Am I missing anybody on the call right now? Okay.
First off, the trailer is always available, but I love the idea of a pontoon boat personally. I love boats. I go to church at Faith Assembly in Humboldt.
Okay.
You are more than welcome to use our parking lot. You're welcome to drive behind. When we do the parade float for like Bible Lesta and other parades, we park it behind our church.
Okay.
And then there's a partial awning back there. I've never actually walked back there and looked at it, but you guys are more than welcome to. I can hook you up with our pastor and you can talk to him about it, but you'll have 100% support from Faith Assembly for decorating parking lot, whatever you need.
Thank you.
We have a full kitchen, so if you need, if you want to set up snacks or whatever, bathrooms, whatever you want to use, you can do that for decorating or whatever.
Thank you.
Mhm.
I don't anticipate the decorating being too outrageous. I try to get things that would work in water, obviously, and I think we got some inflatables to kind of hang off the boat. So I think it's gonna be pretty easy, and then we have a bubble machine. So we're gonna have bubbles coming out. So we're pretty excited about that too.
Sounds like it's all coming together. Thank you for all your work on that. And okay, any other thoughts or comments regarding Water Wars?
How many people participate in this? I haven't ever been.
I would say at least 1,000. I mean, it's huge. I was shocked when I saw the number of people. I'd never been, but I saw photos recently and I was shocked at the number. Yeah, the whole courtyard is like packed.
And is it on the squares?
Yeah. Yeah, and there's people inside the square and outside the square as the floats go around, so you're getting hit from both sides.
And what are you gonna use to shoot water?
For our water.
Mhm.
We'll usually, I have like little baby pools we'll have in there, and then we'll have some gallon like buckets, and then we bought like the water, what are they called? Shooter things,
Oh,
like
yeah.
the foam shooters, and I have some from last year. I try to keep them, but we had to buy a little bit more. So
Be fun.
I think this is the 3rd year we've done it, so.
Sounds like it's going to be a fun event.
Yes.
Lots of participation. So thank you.
Buy another one.
So, okay, the other old business, nominations for president and treasurer, which did anybody have anybody they wanted to nominate or wanted to volunteer themselves? I'm practicing my give people time to speak, pause time.
I think we determined last month that the two remaining ones are willing to remain, so I will move that we keep the two that are there.
Okay,
Second.
do we have a second to that?
Yes,
Who was that?
Debbie Bearden.
Oh, okay, perfect.
So thank
So
you.
Kristen, I guess we're back on.
You might want to say all in favor, just to
Oh,
be
yes,
sure.
all in favor of Carol remaining as president and Kristen as treasurer. Say aye.
Aye.
Anybody opposed? All right, thank you very much. New business, we had the future community event at the library. I know Lonnie he was going to do another figure painting activity. Jessica, did you have an opportunity to catch up with the library? I think there was a death or something, and so they were working on scheduling and things.
Yeah, I have not heard back from the library, but I can do a follow-up with that.
Okay, that will be fine. And does anybody else have any suggestions of activities or events that we might want to consider?
I saw, I think Rookies did it last week, had a lady come in and do a painting, like a group painting, I think it was adults, but I think you could totally open it up to youth too. So I wondered about something like that. That would cost money because you gotta buy the supplies and stuff, but it's like the paint and sip is what they call them in Kansas City and stuff. I love doing stuff like that, but maybe something like that once in a while.
Okay. So our sips would be non-alcoholic.
Right. So we could do, it could just be painting. I think they did
Paint
like a
pie.
fire pit with
Oh,
s'mores.
there you go.
Some pies. Painting and paint treats. There you go.
Or treats, yeah. Cool drinks.
Okay. So that could be something we can think about. And if you have further information on that, Marie, maybe we can figure out some details of, the more details we know of how they put it together and how it worked, that way we don't have to recreate the wheel.
I can give you the teacher's contact information.
Thank you.
Teacher.
Carol,
Yes.
it's a little warm right now, but as it cools off a little bit, the farmers market is open we have 2 free spaces that folks can come there and do activities as well during the farmers market from 5:30 to 7 on Thursday evenings.
Okay. So that would be something maybe. And when's the last farmers market, Debbie?
Well, it's on the schedule till into October, but it really depends on the weather, how long our market gets to go.
Okay. So that would be something if I have an outdoor activity of whether it's I don't know, even if it's just some cornhole boards that people can stop and throw some bags and any other game activities. I don't know. I'm totally open for suggestions there, but
good ideas.
I was just watching the cornhole tournament on TV on Sunday. Wasn't my choice, but it's amazing how many people are, they make good money when they win those tournaments.
The
So,
fact that something to be televised amazes me.
It could be a fundraiser, Carol.
oh, that's an idea.
I hope there wasn't any furniture broken in your house from the excitement, Carol, watching that.
It wasn't at my house.
Oh, okay.
That's why I was not in control of the TV.
You had a cornhole tournament watch party, huh?
Actually, it was my mom's birthday, but oh, gave us something to talk about anyway.
Yeah.
Sit in the backyard, but now the sounds good though. Next thing they have an Olympic in it.
And so those are some options. Are there some other ideas? All is good. So, okay, well, that's something we can definitely look into. Okay. Any other new business that anyone wanted to bring to our attention? Okay. So we're just flying along today. So Jessica, would you like, or Tegan, would you like to talk about the DFC grant and activities?
We're still working on the drug-free communities progress reporting. The submission started today and it is due by the 15th. So we're currently working on that. With the drug-free grant, there's a number of items that we have to submit, such as the KCTC survey and also the coalition classification tool. So I've been working on that. I did submit, just to give you guys a heads up, I submitted the KCTC survey and we have a partially approved. We had missed some documentation that they were required. So I've gone back to Greenbush to get that information. Linda Weldon had sent me the information in multiple documents and they won't let me submit in multiple documents. So it's little things like that we need to get figured out, and I can resubmit this week, but that's also due on the 15th too. Participated in some of their progress report training. They also had a health and equity diversity webinar. So they would like to start having our coalitions around America to start working on health and this health and diversity and kind of work towards doing that. I'm gonna try to get a little bit more information to send out to the coalition on that so we can all be on the same page, and then we can maybe have a conversation around that. Also, Tegan and I met yesterday. We went over the school's MOUs, and so we've sent those off to the superintendents to have those signed. And once we get those, we'll get the people that we're supposed to be working with during the schools. I don't foresee any of them changing. I believe Mr. Fager's already gotten back with us. We'll be using Mrs. Cruisenberry and Miss Dean at the Iola schools, but we're still waiting on Marmonton Valley and Humboldt on those. And then we'll be working together again we're continuing to working to plan lesson plans and whatnot for the upcoming year. So we're working on that too. And then of course the water war float is kind of taking up our priority in the next couple weeks.
And what are MOUs? What are MOUs?
So we're having agreements with the schools to have an inside mobilizer to help us engage the youth. So they help us with logistics of meeting in the schools and making sure all our activities are carried out. And that's just to kind of build that trust with the youth because they're there in the schools, right? They know them. So that's kind of
memorandum of understanding.
Yeah, sorry. But yeah, we're just having that partnership within the schools. So when the drug-free community grant ends, we can still have those contacts in the schools so we can start, continue our prevention efforts. So thank you.
Tegan, did you have anything to share?
Well, I'm just so excited you guys voted me in last week. I've officially started this week back on the drug-free communities grant, and I'm really excited about gearing up more of the social media, the newsletter, getting, being able to put some more time into our youth action team, our lesson plans and the activities that we're gonna do there, and maybe some recruitment for some more kiddos. So, yeah, I'm just excited to be back.
Yes, thank you. So, at the, just to clue everyone in, if you said it, Jessica, I missed it. At our board meeting, with Jessica continuing her degree, and is it clinicals or that you work on?
I'm just getting my master's in social work.
Okay, okay. I knew clinicals word didn't sound right, but anyway, it's going to take up more of Jessica's time doing that. And so Jessica and Tegan are both going to be part-time employees working on the DFC grant.
Yeah.
So,
And Carol, they're both, not that they mentioned, they both will be working on their clinical internships. So they will be learning what a therapist's job is.
okay, so I wasn't totally off with the word clinical.
You were not off with clinical. You did hear that. And then at some point they'll have clients that they'll be seeing. So yeah, it's pretty exciting for them.
Yes, it is. So very good. So, okay. Bucks for Buckles.
I talked to Michelle Hoyt about this. We need to probably start taking this on as a coalition. And I looked on the website for Kansas Safe Kids. I wasn't able to see the grant open. So I'm gonna try to reach out to the program director to see if that's still available. And then I can give you guys a report out the next meeting.
Okay.
Now, what is the Bucks for Buckle? Like, I've heard that before, but I have no idea what it is.
So it's an event that we receive funds from the state to do a seatbelt safety awareness. So we try to do it before schools and have that event as an education opportunity to see if students are wearing their seatbelts. If they're wearing these seatbelts, they get $1. If not, they would get a dum-dum with some information on it. And then we've also done it at, I think, a home football game, and both in Humboldt and Iola. So yeah.
It's always a fun event. So that people actually try to give us money.
They think we're parking or something.
So, okay. Anything else to report there? Any collaborate? Oh, you have all your collaboration stuff reported. So we will move on to agency updates. Who's got stuff to share? Can't believe it's a slow time. School coming up. Nobody's got anything right now?
I'll mention that K-State, the president has selected his locations for his community visits for the next school year. And that is going to include a visit to Allen County and Humboldt, October 4th and 5th. So just keep those dates in mind. I know we don't have a complete schedule released yet, but that will be.
So the president?
Yes, the president of K-State.
Hey.
Carol, I don't believe Josiah's on today, right?
No, he's not.
Okay, so he is director of student life at the college and sent out a flyer for Welcome Week activities. Jessica probably has a good notion of this coming up, but there are daily things going on out here. What
is it?
It's August 19th through the 31st. The 19th is just work move-in day, but then there's a casino night and a blizzard night and the program at the theater called A Shot of Reality. I'm not sure what that is, but that might be interesting. There's a block party on the 22nd, but you know, if there was any materials that any of our groups wanted to give out, drug alcohol awareness would be opportunity if you want to latch onto that, and I could sure make this flyer available.
That would be great. Yeah. And you said there was like a block party?
Yeah, the
too?
22nd. What
the
we
22nd.
usually, I think they have a cookout for students, and it's just a mix and mingle. Probably be cornhole. They'll have cornhole and just some other things going on.
Last year we set up a booth at something during back to school. Do you think that was the block party night or a different night?
It could have very well been if it was at the college. That's a time when most of the new students and a lot of the returning students are going to be around.
Okay, thank you.
Uh-huh.
All right. Does anybody have any thoughts? I mean, see the block party, do you know what time that starts? Or would that be the best activity to have if we were going to try to have any brochures or information available?
The block party is 6 to 8.
Okay.
There is the others are going to be so busy, you know, the Blizzard night, movie night, casino night. I mean, I am curious about this shot of reality at the Allen Theater. Sometimes they have people come in and talk about some real world stuff like date rape or alcohol abuse, substance abuse. I could check more into that, but the block party is 6 to 8 p.m. on the 22nd, and that's probably in the courtyard area around by the student center. But again, I can double check that. I'll send you this flyer, and then if Josiah wants to follow up with any more specific information, I'll ask him to do that for you, okay?
Okay. Yeah. So the 22nd is a Tuesday. So does anyone have any thoughts on us having a booth or having information available?
I think I would be available. I'll get with Josiah to see if we can sign up to have a booth.
Okay. And I can help with that evening if need be. So I think that's a great opportunity to get that info out. Sorry, go ahead, Bruce.
Oh, I'll be out here probably anyway, so
okay,
I would be available.
All right, thank you. Anyone else have anything to share?
Carol?
Yes, Debbie.
Next week will be National Farmers Market Week.
Okay. So do you have special stuff going on at the market?
Yes, a little bit.
Okay.
Mainly just promoting it, the fact that encourage folks to check out the farmers market if they haven't been there yet.
Okay. Very good. All right. And you have a retirement party coming up.
Yes, ma'am.
Really?
Yeah.
I didn't ask for this party, but I am resigning from the Farm Bureau. So.
So, and what date's that retirement party?
August 11th from 4 to 6, and then the annual meeting is from 6 to 8.
Okay. And that's there at the Bass Community Center?
Yes, the North Community Building.
Yeah, North Community Building. Okay. All right. Well, congratulations.
Thank you.
Anyone else have anything to share?
Hey, Bruce, I know
Yes.
a couple of nights ago, they did a big old educational thing on sex trafficking. So that might be what you're going to be introduced to during your college stuff. And it was highly interesting to see how sneaky and how clever these guys are to get that started and how much closer it's getting to Allen County.
Yeah.
It was pretty creepy.
Wow. Probably very good information to have out there.
Mm-hmm.
That would be a good program to have out here. Would.
Okay. Anyone else? Lots of good stuff. Okay, if no one has anything else, do I hear a motion to adjourn this meeting?
All motion.
Do I have a second?
I second.
Okay, all in favor, say aye.
Aye.
Aye. All right, anybody opposed? All right. So, all right, this meeting is adjourned.
Y'all
Thank
take
you all
care.
for taking your time out today. Have a good one. Bye.
You.
Oops, sorry.
Didn't sound very exciting. Yeah.